Have you ever left a doctor's office thinking, they didn't really hear me? You're not alone. Let's talk about something so many people feel but rarely say out loud. Doctors who don't really listen. Just the other day, I was in a cab heading to a hospital meeting. The driver found out I was a pain doctor and immediately opened up. He told me, "My doctor never listens to me when I talk about my pain. I think it's because of my accent." That made me pause. Was it really his accent or something else? Are we doctors truly listening to the patient or just hearing them? I'm not just a doctor. I have been a patient too, and I've had some painful experiences where I was not believed. After a bunion, minor foot surgery, I was in constant pain. Every time I told my surgeon, I heard the same line, "It's just normal healing." But it was not. Because of my constant complaints, he eventually ordered new imaging and found out that I had a serious issue that required a second bunion surgery. After another procedure, I knew something felt off. I asked multiple times, could this be an infection because I'm in so much pain? The office staff and the doctor brushed me off. They said I was overreacting. Weeks later, my skin opened up and pus came out pouring out in my office. A hidden stitch had been causing a deep infection for weeks. And then a close family member had a brutal, painful rash for 12 years. The doctors blamed poison ivy or bed bugs, even in the winter. And he would say, "How come my wife doesn't have this if it's bed bugs? We share the same bed." No answer. So I did my own research. I found a condition called dermatitis herpetiformis, linked to gluten sensitivity. He cut out gluten, and 48 hours later, his skin was clear. He had an undiagnosed celiac disease. After over a decade, his doctor finally said, "I'm sorry for not listening to you." So here's the question I keep coming back to. If I, as a doctor, had trouble getting listened to, what happens to you? This is not about blaming doctors. It's about changing the culture of communication in medicine. Doctors are human. We make mistakes. But that should not be the end of your healthcare journey. So what can you do if you feel unheard? Number one, ask questions. It's not a challenge. It's your right. You deserve to understand your care. 2, trust your body, but stay grounded. If something feels wrong, say so and use your instincts to start the conversation, not end it. 3, be clear and repeat yourself if needed. Try, "I need to circle back to this concern. I still think this is important." 4, bring someone with you. A second set of ears can offer support and even speak up for you. 5, don't hesitate to get a second opinion. You're not being difficult. You're being thorough. 6, avoid the extremes. Don't blindly trust, but don't give up on the system either. Find the middle ground where your voice stays strong and your health stays priority. Have you ever felt dismissed by a doctor? Tell us in the comments. You're not alone and your voice matters. If you like this video, give it a thumbs up, leave a comment, and don't forget to subscribe. Thanks for watching the Pain and Wellness channel. In our next episode, we will flip the script. What happens when patients don't listen to the doctors? See you then.